patient presentation. What does the typical patient come in with? We'll start with typical and also atypical. The typical patient comes in with, I have heel pain. First step in the morning, I have to get up. I have to hobble a little bit. It'll slowly loosen up, but I start out and I walk like an old man is typically what we hear. I can walk a little bit, loosen it up, and it's not too bad. If I sit down a little bit at work, I get up from my chair, same thing. If at the couch in the evening, I sit, I get up, same thing. That stiffness after sitting, very common complaint from the patient, very classic. Also, no specific trauma. Also, recent gain in weight, recent increase in activity, many times recent gain in weight, so I went out and started walking or running and I just grabbed whatever shoes that I had. That is going to be a classic presentation for plantar fasciitis. Now, the abnormal one is if they're not telling you that exact scenario and if there was trauma involved, if it was a fall from a height, if it was an impact. I have patients that were stomping their feet and they might not have thought much of it. A lot of it can be trauma related, and we'll get into those as far as differential diagnoses. But first is asking those questions to the patient of, has there been an increase in weight, increase in activity? Look at the type of shoes that they're wearing, because they may say, oh yeah, my shoes are great, but look at what they're wearing. Are they barefoot at home? Are they wearing a sandal with no support? Are they wearing one of these new flat, almost moccasin-like shoes, or one of the new cushion shoes that is allowing too much pronation? And they may think, hey, the advertisement said this is for plantar fasciitis. This was an arch support shoe. Do not take their word for it. Look at the shoe. Have them bring it in. Have them describe it or name the specific shoe. A lot of times they can just look on their phone and their Amazon account and say, oh, this is the shoe that I have. So don't take their word for it. Ask lots of questions to see that this is a classic plantar fasciitis, or is there some trauma? Could there be a stress fracture of the calcaneus? Could there be a fracture of the plantar calcaneal exostosis? We'll get into the differential diagnoses, but first, ask all of those questions. Athletes ask, was there increased mileage, change in shoes? How many miles do you wear your shoes specifically? Those are some of the more detailed questions to get into, is a change in pattern. And I'm not saying don't believe your patient, but question more detailed when they give you those questions about their shoes specifically, about their mileage. What do they do at home? One of the big take-home points for the patient at home is they discount everything that's at home. Like, I'm wearing my orthotics and my shoes at work and I'm there all day, and so I'm doing everything that I should be doing. Well, the questions with that are, well, show me your orthotic. Is this an over-the-counter just piece of foam that absolutely is not an orthotic? And a shoe that they said, well, I spent $150 on that shoe, it must be good. Well, it may have no support whatsoever. They go home and then they're barefoot and they say, well, how long are you barefoot at home for? Well, I'm just at home. And it's like, well, 4 or 5 hours of time barefoot at home. That really adds up. So the patient that thinks, hey, I'm doing everything I can for this, I don't know why I'm not better, actually had no support, improper shoe, and was barefoot at home. So don't take their word for it. Dive in a little bit closer and have proof of, show me the orthotic, show me the shoe. Tell me exactly what you do when you get up in the morning. Are you walking around for a couple of hours before you even put on your shoe or an arch support sandal? And if you're going to call it an arch support sandal, show me. All right, lots of questions, and here come some diagnoses.